Hey, how you doing? Hey, how you doing? Hey guys. Hey girl, hey. Okay, so guys, today I'm going to be putting out a little bit later my official unboxing of my IVF meds. But I wanted to go ahead and give you guys a closer look of everything that I received and how we're preparing. So today is April 2nd. I keep saying April. May 2nd. Thursday, May 2nd. And it's officially the last day of my birth control. Yay, I was so excited about not having to take birth control anymore. You don't even understand. But I'm going to give you guys a closer look at my meds, how I'm preparing, and what do I think going forward. So the most important thing that I received was what needs to be refrigerated, and that was 4 boxes of Follistim. So I received 4 boxes of Follistim in the mail. These are to be used with the Follistim pen that I also received. So it's 4 of these in here. And then I also received the Follistim pen. Is it upside down? No, it's not upside down. I received the pen. So you'll use this pen with the cartridges to do the injections. I'm going to be on 75 for these. So let's go ahead and open this because I have yet to open it. It comes in a little case. It's kind of cute. Oh, wow. And here is my pen. And I take it that these are my needles. And then it should have a Q-cap. No, this isn't the one with Q-cap. These are the needles that I would use. And there's 1, 2, 3, 4, 5, 6, 7, 8. 8. There's 8 needles that I would use. So I guess for 8 days. If there's a difference, it's probably somewhere in the box. But this is the cute little thing it comes in. You guys know this is the pen that you dial. You dial it. And it gives you the dose. So this is really cute. And then it says on there to be used with the cartridges only. So there's that cute little case. All right now. And since it's non-returnable and non-refundable, I can open it because it's mine. Can't do nothing else with it. So that's the pen. The pen that goes with the Follistim. And then I received 5 boxes of Ganirelix. So I got 5. Ooh, I got 5 boxes of Ganirelix. 1, 2, 3, 4, 5. I got 5 boxes of these. And for the Ganirelix, there was one that I opened it because I wanted to see what it looks like, because these are the ones that are already pre-measured. Oh, I opened this. Let me see. These are already pre-measured for the dose that you're going to take. So this one looks like this. It has a little air in it, as you can see, so you can prep the needle. But it's ready to go. I got 5 doses of this. It's so crazy that I'm like right at the point. Like I'm getting there. Like, I'm getting there. And then you guys know I have the Menopur. Crap. Dropping everything. I got 3 boxes of Menopur. This is the one that you have to mix. So I'm going to go ahead and open this one so we can see what it looks like inside. And even though I'm not giving myself an injection, I wash my hands very, very thoroughly. So there's 5 Q-caps in here. And as you guys, the Q-caps is what you use to mix it. So you'll draw in all of the sodium chloride, and then you'll use the Q-cap to insert it into the Menopur powder, mix it up, and then inject yourself. So these are what the Q-caps look like. They look like this. Oh. Of course, I show you the hand with the broken nail. They look like this. And this is what you'll use to mix. So this will screw right onto the syringe itself. So each box comes with 5 Q-caps, so they're not reusable. And this is the Menopur. So Menopur, it's going to come like this. So each dose, so this is the sodium chloride, the liquid, and this is the Menopur itself. So it'll come already pre-done. So there's 5 of those in there. Seeing them just gets me excited already. So this is exciting. So that's what the Menopur looks like. close this up. That way I know this is the box to use first. And then I received the azithromycin, which I believe is the steroid that they give you. There's 6 in here. So they're supposed to give you a steroid at some point before your retrieval to fight infection. So I think that's what the azithromycin is for. I had to take the azithromycin years ago because I have something called folliculitis, was the part of my traction alopecia, and that's kind of like where you can't have something, you can't be restricted, you can't get really hot. So like right now under anesthesia, I'm not hot yet, but eventually she gonna have to come on up off my head. So that's the azithromycin. And then we have the cabergoline, which is, I think, a medicine that I'll start taking before I start doing the ganirelix shots. I don't do those right away. I do those a couple days later when she tells me to, so I think I have to take that with it. I got a prescription for estradiol, so more estradiol. I still got a half a bottle of estradiol, but I don't think they realized that when they sent the order, because they kind of changed my birth control at the last minute, so I probably could have saved some money with not getting another one, but it's okay. And then this is the baby aspirins. It didn't tell me exactly when to take it, but I know most people take the baby aspirin during the 2-week wait. So it may come from there. There's 30 in here, so we'll see. And then the last thing I have is the HCG shot. Whew, it's 10,000 units in the muscle as directed for 1 dose. So this is my HCG shot. And okay, it is in there. So it comes with the sodium chloride again, the water to mix. If I can get it back in the box. I have OCD. I really want to go back in the box. And then here's the powder. The powder that you have to reconstitute. Here's the powder. So that's all the meds that I have. And then they sent me a ton of needles. So I got this bag has 2 22 gauge to mix and draw the HCG. It gives me a 25 gauge to insert the HCG into the muscle. They gave me injection band-aids, so there's 40 band-aids in here, and then they gave me 40 alcohol prep swabs. Now the reason I went ahead and I asked for these band-aids is because these are the little round ones that just go on that spot, so they don't go anywhere but on that little tiny spot, and they're just so adorable. I wonder, can you see it through the package? They're just so adorable. So I got those, and then this is my big bag of all the rest of my needles. So in here there's 22 gauge to mix the Menopur. There's 20 of those, and then there's the 27 gauge to actually inject the Menopur subcutaneously. So the 22 gauge is the big ones, the big huge ones here. That's to mix. Thank God. And I'm gonna show you in a second what those look like. And these are the 27, which are to inject, which are like microscopic, which is awesome. So I got all of this. All of this came, and then I have my. Me and my husband have a running joke about our sex life, and I always say, "Would you like a rubber chicken in the room?" And he always says, "If she's sexy." So I found this rubber chicken in Spencer's, and now she's my IVF partner. So everything that I'm going to be going through, I got her to back me up. And she's got on purple, and you guys know I love purple, so that's what she's for. You'll see her in the snippet in the actual video I release. So what I also received, and it's too far for me to reach, is pretty much these, but 5 of each to practice. Now, I told you guys, I'm going to make this quick. I told you guys that I tried to practice with my husband the other day, and he was just doing too much. Like, doing too much. Let me show you what he was doing. So, the way they showed me to practice is to take one of these, one of the syringes, put a little water in it, okay? And they said that, you know, in order to get the water in, of course, you have to use the big ass needle. So let's screw this on. This is the one that's always used to measure only. So this long ass needle. So you only use this to draw out the medication. You never want to stick yourself with this because you might die. No, I'm just joking, but you might mentally die. But you draw it in. You don't want to leave that much air, but a little bit of air. And then what you're going to do, and I went to nursing school, so I'm not going to do stick, put it back on. I'll put the cap back on here, like that. You want to unscrew this needle. I was a little more detailed when I talked to him, but I know y'all ain't special as he is. And then you want to take the needle you're actually going to use, this little one. You want to screw it on, make sure it's secure. You want to uncap it. We want to find where it needs to be. So for sake, I'm not going to give a number, but just look. So you want to get all that oil. You want to tap it. This is where the heroin joke, he said, came in, and the cocaine is ready. So you want to tap it, get those bubbles out. Then you want to draw. So ignore that there because it was laying sideways on my bed. But you want to draw all the air out. Let's make this bead go away. So you want to draw all the air out. And then you want to push up until you see just a bead. Okay, you guys see that? Just a bead. It's a little bead. You see it? Okay. So then I told him, I just wanted him to get comfortable with inserting. So they told me the best thing to use is an orange or a grapefruit. So I grabbed an orange off the table and I said, I don't want you to stab. I don't want you to jab. I don't want you to be funny. I just want you to take this needle. When you're ready, go straight in. And then you want to take that plunger, and I told him you want to go slowly and inject the medication. Slowly. I let him know, go ahead and do it. There's no fast, no fast. I said a lot of these medicines are kind of thick, so you'll feel pushback. Just do it ever so gently. I let them know. They said that once you got all the medicine out, we're going to wait 5 seconds. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5. You want to pull it straight out. You think that's what my husband did? No. My husband was like, 1, 2, 3, in. 1, 2, 3, 1, 2, 3, you ready? And I'm going to count to 3. I'm like, okay, 1, 2. He was just doing too much. So, guys, I'm going to do this shit myself. And I'm going to have my best friend's mom do the shot that I have to do intramuscularly. And I'm going to have her do that. She's willing to come over and do that. So, yeah. That is where I am so far. Those are my medications. I'm going to put all this in my Sharps container. I asked for a gallon because they usually have a little skinny one they send you. But in, done. And so this is where we are. Today was my last day of birth control. I hope you guys enjoyed this little video so I can show you exactly what my meds are. And you like my orange demonstration. I'm looking forward to coming back and rocking with you guys. So the next time I see you guys will probably be maybe one day this weekend when I tell you how I feel going getting closer. I do have an appointment actually tomorrow morning to have my ultrasound to make sure my levels are good and make sure my blood work, everything is normal and everything. So I definitely am going to do that. I'm going to do that. So you'll get that updated on the weekend. And then after this weekend's update, the next video you get from me will be the day that I do my first injection. Will be May 7th, which is Tuesday. So I'll see you guys then. I hope you guys enjoyed this video, and I will talk to you soon. Bye.